Officials at New York University Hospital, NYU Langone Health, have announced the hospital's discontinuing its Transgender Youth Health Program. Translation: no more transgender surgeries, hormone therapy, and puberty blockers for minors. So is this the beginning of the end to this life-altering treatment of America's children? Here to offer his perspective is Air Force Colonel Josh McConkey. Dr. McConkey is an emergency room and combat physician, a flight surgeon and Iraqi freedom veteran, and author of the book, Be the Weight Behind the Spear. Dr. McConkey, thank you for being with us again. So what motivated the NYU hospital officials to stop providing this treatment? Was it a sudden moral conviction about the harm it does to children, or Donald Trump threatening to pull their federal Medicaid and Medicare payments? What do you think?
Well, what really swung that decision for them was the threat to not pay hospitals that take CMS, so that's your Medicaid, your Medicare funding, and not give money to hospitals that are doing these types of surgeries. You know, the evidence has not really supported this type of practice, and this is just the government getting back to only funding medical research, like medical treatments for things that actually have some proven benefit.
Well, you served as a flight surgeon and a combat physician in Iraq, and you're an emergency room doctor. So tell us the effect that gender-altering surgeries, puberty blockers, hormone therapy have on the health of our children.
So, I was a Duke professor as well. So, as a professor, we really teach evidence-based practice. And if you're going to be using treatments, or if you're going to be doing surgeries, they have to have a proven benefit. Now, the proponents for the gender-affirming care and those surgeries, the studies that had shown any short-term benefit were very, very low quality. And in fact, when you look at the long-term health effects, they're actually quite dangerous. So when you look at the mental health issues alone, and when you look at the bone density and brain development, those types of things have long-term health consequences that we're now seeing it's just not good treatments. There's not evidence-based practice to support it.
Well, I'm sure you've saved many lives over the years. Why would physicians dedicated to preserving and protecting life, health, and wellness be involved in doing this to little kids?
Well, this was just a time in medicine that as you roll the clock forward 5, 10 years from now, it's going to be a dark time. So when you look at the decisions that were made, there were too much politics that jumped into medicine, and it just overran common sense, and it overran like the standard evidence-based practice that we've been doing for decades and decades. So I think the evidence long-term has shown a lot more dangers, and they're making the right decision.
Well, in 2022, about 105 hospitals provided some form of gender-altering treatment to minors. More puberty blockers and hormone therapy, I think, than surgeries. And the numbers are now down to about 55. So what will it take to bring that number down to zero?
Well, just the research has not been supportive of that. When you look outside of the United States, you look in Europe. The UK had a great study in April of 2024, the CAS review, that just showed lack of benefit and some of the dangers for long-term health. So most of the European countries, when you look at all of Scandinavia, when you look at the UK, France as well, so a lot in Italy. So they have either restricted or banned these types of practices as well. So the United States is really just coming in line with international practice.
And for those who underwent surgeries, received puberty blockers and hormone therapy as children, and want to detransition, what hope is there medically that they can return to their previous selves? Is there any?
Well, they certainly can. Now, there's going to be some differences when you look at the long-term issues when they talked about bone density, muscle mass, and the biggest concern was for fertility. So you've heard time and time again, a lot of the individuals that have undergone some of these treatments and surgeries, unfortunately, have become permanently sterile. And when you look at, just like I have 3 children, those are the things that I am most proud of. And, just producing something, my wife and I, that we know is going to live on and hopefully do great things. Of just having children is just one of those fundamental things that are so important to humanity. And you take that away from these children, it's almost criminal.
Yeah, I know Chloe Cole, who is detransitioned, regrets that she cannot have children now. And finally, Dr. McConkey, medicine and science tell us that Females are given two X chromosomes at birth. Males receive an X and a Y. You really can't change that. So little girls always seem to go through a tomboy stage. Little boys test out their mommy's high-heeled shoes. So that doesn't mean they should undergo gender-altering treatment. So what do you say to parents and children who may be confused about their birth sex?
Those are just personal discussions that they need to have with themselves, within their family and their physicians. These types of medications can be very, very harmful long term. I'm a very strong proponent of, doing what's right for you and your family with your doctor, but not doing anything until age 18. The medications and the surgeries, certainly just under age 18, are pretty barbaric.
Okay, Dr. Josh McConkey, thank you for sharing your medical expertise and your insights. We appreciate you.
Thank you.